right, welcome everyone to the ADA Learning Bites session. Our title today is Between Two Appointments, How to Leverage Daily Diabetes Data, both in clinic and remotely, to improve patient outcomes. Our speakers today are myself, Zach Henderson, Chief Commercial Officer at Glooko, and Dr. Mark Clements, Chief Medical Officer for Glooko as well. In today's digital health world, patient data is captured 24/7 on a wide range of devices, such as BGMs, pumps, pens, fitness and health trackers, CGMs, other wearables. How can you make the most out of this massive amount of data and the fragmentation of devices to care for your patient population? What solutions are out there to remotely intake data in between appointments to better inform your care plans and address emerging health risks before your patient comes into the clinic? We will address those questions and more during this discussion between a leading endocrinologist who is recognized as an expert in diabetes data analytics and a healthcare executive veteran also with extensive knowledge in healthcare data and analytics. Join us as they share their insights on how to leverage patient diabetes data and use it to lead to improved patient outcomes. So coming out of our pandemic of COVID-19, we've seen digital health adoption accelerate rapidly. Patient data is captured 24/7 on a wide range of devices, such as BGMs, CGMs, pumps, pens, fitness and health apps, and other wearables. It is now an absolute requirement to be able to collect and synthesize these patient data remotely. In fact, diabetes and in general, chronic condition care management has evolved into a hybrid model of both in-clinic and remote care optionality, requiring coordination, additional technology, and in some cases, different or incremental personnel resources. This leads me to my first question. Dr. Clements, how do you feel we can make the most out of this massive amount of data to care for patient populations and getting the data to help us overcome barriers to care?
Sure. Thanks, Zach, and thanks everyone for being here today. We're overwhelmed by data. It was once said that we live among, oceans of data, but only droplets of wisdom. And I think the busy clinician doesn't know what to do with it all because we haven't set up the best systems for harnessing it in our electronic health records, and in our clinic workflows. I think that having solutions that will help one to distill those data down into meaningful actions in moments so that you can guide a conversation with a patient or person with diabetes is the order of the day. And in diabetes care, the data that we receive come from glucose monitoring, they come from insulin dosing, sometimes they come from physical activity and other behaviors. And lining those data up to gain insights across data streams is extremely important. So we need simple solutions, simple visualizations, and insights that lead to action.
Insights, not data. I couldn't agree more. So based on all that, what have you noticed in your practice of patient patterns and trends in the data that help to identify those barriers to care and, more importantly, indicators of patient compliance and health outcomes?
Sure. We think about whether a person with diabetes is engaging in their self-management at several levels. So the first is whether the individual is engaged with monitoring glucose, whether they're on a continuous glucose monitor or a blood glucose meter. We also think about whether the individual is engaged with insulin dosing and in the very important basal insulin that they receive. And we think about whether they're engaged in other pillars of diabetes self-management, like eating a healthy diet and physical activity. So, in terms of trying to gain insights from that, we can see an awful lot of behaviors in the diabetes data that are collected on everyday devices used in diabetes self-management. And these behaviors can be observed from objective data rather than from subjective report that might be subject to recall bias by the individual.
Yeah, that makes sense. And can you comment a little bit too on during the pandemic, since in-clinic appointments haven't even been possible in many cases, how has the industry adopted to still provide care for the broad patient population?
Sure. Some studies have indicated that clinics, which quickly had to adapt in March and April of 2020, ramped up from sometimes less than 5% or less than 10% telehealth to greater than 70 or sometimes greater than 90% telehealth, all on the order of about 4 to 6 weeks. So it was just a tremendous shift in the entire field. Some of the casualties of that shift have been things like the hemoglobin A1C, which is a laboratory test that's usually obtained at every visit as a broad indicator of glycemic control. But when the individual with diabetes is not coming into clinic, they're not getting labs drawn. So what do? Well, fortunately for us, there's been a lot of research using continuous glucose monitors in the last few years that have indicated how one can reconstruct and perhaps even improve upon measures of glycemic control in diabetes from a CGM data stream. So indicators like the glucose management indicator, the average blood glucose, the time in range, and so forth.
Gotcha. So it's almost beyond A1C metrics that are
beyond A1C metrics have become critical during the pandemic, and we've relied on them quite heavily as a replacement for traditional approaches.
Yeah. And now that we're opening back up, so to speak, not only in the United States, but around the world, given the proliferation of the vaccines, how are you seeing the balance of in-clinic versus remote care continuing in this new normal?
Sure. Certainly, everybody is anxious to get back to some sense of normal operations, whether you're in healthcare or elsewhere. But I think healthcare is a little bit unique because you sort of nailed it. We're in a new normal. We've opened the box and we've probably accelerated the evolution of healthcare delivery 5 years in a very short period of time. I would say that centers that were never doing any telehealth, never doing any monitoring of patients between clinic visits are now doing that. And centers that were doing it were generally doing it about 10% of the time or less, and are now doing it much more. And I think if you look at other industries, what you see is once consumers understand the benefits of more on-demand, to your door delivery of product, and healthcare is in some senses a product, right? It's a service that we provide to individuals. They hesitate to go back, right? There was a great book a few years ago called "If Disney Ran Your Hospital," and one of the premises of that book was that your competition as a healthcare system is not the next hospital up the road. Your competition is the last best service experience that person received. So if they received their coffee just the way they like it in 5 minutes or less with a smile, that's what you're trying to achieve. And people would like that kind of experience, a more digital consumer focused experience in their healthcare. We see it happening.
So a DoorDash for diabetes, if you will.
There you go. I like it.
That's great. So given that these dynamics are occurring and people are adapting to this new normal, kind of what are the key considerations that you feel are necessary when endocrinologists such as yourself are evaluating digital health solutions to do this type of remote patient monitoring and chronic condition management?
Sure. Well, you have to think about what the basic components are, right? So communication is the cornerstone for everything. If I can't see, can't hear the individual or the family, then I can't deliver adequate care. So having excellent video, telehealth software, super important. And this includes, software that can typically manage those fluctuations in internet speed that occur. And having the ability to seamlessly, quickly, and simply receive the data that are guiding the person in their daily self-management, so that you can identify problem areas collaboratively with them, so that you can identify opportunities for optimizing just the right dose of insulin to just the right person at just the right time, that goal of precision medicine. And so that you can track what you're doing. You can see who has received care, whether they have received care that falls into certain buckets or categories that might allow one to bill in one way or another, for different levels of care. These are all critically important. And then finally, the ability to document what you're doing in the electronic health record. So if you're using systems that allow you to interact with a person's data or with the individual outside of the medical record, we have to be able to get that information inside of the medical record. Health systems really demand it.
Yeah, that makes sense. Well, I know you're busy and are probably off to your next appointment, so I can't thank you enough for joining us here today at the ADA Diabetes Learning Bite Sessions. This one between two appointments, which you always are. How to leverage daily diabetes data, both in clinic and remote, to improve patient outcomes. We look forward to the rest of the sessions, and we'll talk to you next time. Thank you, Dr. Mark.
Always a pleasure. Thank you.